considering the vaccination and social distancing by Mr. Masuli.
Yeah. Thank you so much. Give me a minute to share the screen here.
Okay, I think Mr. Masuli, you may be able to share your presentation now, please.
Sure. A minute, please.
And thanks, Miss Ayuna.
My pleasure.
So do you have my presentation right now?
Yes, sir.
Screen? Okay. Okay, hello everyone. At the beginning, I'd like to appreciate the opportunity given to us to present our research on COVID-19. In fact, since the beginning of the COVID outbreak in Hubei province in China, we also initiated our research investigating different aspects of the COVID-19. And here is the research completed together with my colleagues from Iran and China, working on the probabilistic prediction of spreading profile of COVID-19, considering the vaccination and social distancing. To start our discussion on this research, let's assume that the whole population of our society gonna be this box here. So the ideal case is to go through the society and pursue each individual case one by one in order to understand the flow of disease in the society. But it is not, of course, practical. So we made some assumption. We divided the whole population into some compartment, including susceptible, vaccinated, social distancing, infected, hospitalized, recovered, and dead. And in the next, I can show you the relation between these compartments here. Since the time that the disease started, we can expect that, okay, this pandemic, this epidemic may enter our country, and thus we can think of the people to be susceptible to disease. And maybe after a while, unfortunately, some infected cases will be found. And then part of this susceptible people would be in contact with those infected cases. So this part of the susceptible population, we call it exposed. And the ratio between susceptible to exposed, we're gonna show it by the term beta. And then those people who are in touch with infected people, not all of them get infected, but part of them, right? So we are going to show the connection, the relation between the exposed to infected by the term gamma. And then the people here infected, probably they need to be quarantined, but not all of them, right? Depends on the disease severity. And the relation between the infected and quarantine, I'm going to show it by the term delta. Okay, let's turn back to the susceptible. The susceptible community, some of them gonna get the vaccination, and hopefully we hope that after vaccination they're gonna be immune. Also, part of this susceptible community probably stick to the social distancing rule, and thus we again think that and hope that they gonna be on the safe side as well. So after that, let's again go to the quarantine. Part of the quarantine, guys, again depends on the disease severity, may need to be hospitalized. The ratio, the relation between quarantine and hospitalized, we show it by the zeta. And due to the service of medical services, some of these quarantine and hospitalized guys can be recovered. So we're gonna show the relation between them by psi and lambda. And unfortunately, some of them may die. So the relation between quarantine and death, we show it by kappa, and between the hospitalized and death, we show it by phi. So this is the whole system that we created here in order to mathematically model the spread of the COVID-19. I just showed it here visually, but I can show you the differential equation governing this system here. This is the system of differential equation governing the spread of pandemic. And this system is pretty complicated because there are many parameters, many model parameters. You can see there are too many model parameters here that are unknown. We don't know these parameters. Additionally, there are fractional orders here. Again, we don't know those fractional orders, so the model is too complicated. If I want to list the whole parameters, you can just find them here. You can see there are over 20 parameters involved, and so the model, the complexity is really high. I mean, in terms of a mathematical problem. Also, we have some initial boundary and initial condition. For example, the number of infected cases at time 0 is I0. So this is an initial condition. Or number of recovered people at the beginning going to be R0. So this is also another initial condition. Additionally, we have a boundary condition, that is the number of the whole all the compartment, for instance, susceptible, exposed, vaccinated, quarantine, and so forth. The summation of these is going to be the total number of population. This is also a boundary condition. So considering the initial condition, boundary condition, and many unknown parameters, this is going to be a really tough job if we want to match the differential equation to the real data. And for this job, we need an optimization. But we actually, at the beginning of the research, we tried many optimization algorithms, including the derivatives-based one and also the heuristic ones, but none of them succeed. So we just later come up with a new solution called a stochastic optimization that we just like to call it back analysis. It has two steps. I will explain it to you here. So these are just all the factors and parameters involved, and I am going to consider them as random variables. For that, we can make many random samples for all these terms. I mean, both model parameters and fractional orders. And then I put these samples into the differential equation system that we had. And finally, I can get the infected, the recovered, and the dead time history for each of these samples generated. So next is the real data. What I just showed you was the model, right? Model prediction randomly. But here is the actual measurement for the infected case, the recovered, and the dead case in the US. So what we did was to define an upper bound and a lower bound around the actual data. So we have an allowable range here. Also, we did the same for the recovered, and we did the same for the dead cases. So then we try to find which of those random samples we previously generated can fall within this allowable range. We're gonna find this one, okay? So I can show you the algorithm how we did this. These are just the random data we previously created. And right now, I just compared them with the actual case in order to understand which of these gonna fall in this gray range. So this gives us some of the samples rejected and some of the samples accepted. So I'll put all those accepted cases in a new data set called optimal parameters. This is the first step of the back analysis. Next, we go through the next step. In the next step, we define a root mean square, RMSE, for infected case, recovered case, and dead case. And we use SRSS in order to make a RMSE total, and use this one in order to rank the samples, the optimal samples. And finally, we come up with the most optimal case. These are the optimal parameters, and these are the optimal fractional order. So if I want to show you what is happening, I can provide this slide to you here. So as you can see, these gray lines are those random samples we generated, and these small blue circles are the actual data, and this blue solid line is our optimal case. As you can see, it is beautifully matched with the data. And this dotted red line is optimal, but the fractional order is considered as 1. So we are going to continue with the most optimal case, which is matched with the real data. But there's another problem, and the problem is that we are not sure if this data provided by WHO is really accurate. We don't know if they can represent the exact status of disease in society. That means we have some sort of uncertainty. So we need another mathematical tool in order to consider the uncertainty. For that, we just continued collecting the optimal samples from the first part of the optimization. These are the histogram of samples for the fractional order coming from the first part of the optimization technique. And then we just put them into one set. So this set is the optimal samples coming from the first part of the optimization. And then we used a technique called Bootstrap Sampling, which is based on random permutation. So we get many samples from this pool, from this data pool, in order to make the bootstrap set 1, bootstrap set 2, bootstrap set m, and we again put it into the system of differential equation in order to get the infected, recovered, and dead. So we have a new data set of random samples. And then we put these samples into the Monte Carlo simulation in order to calculate the probability. And the results gonna be so interesting. This is the result of our analysis here. So on the left is a 3D graph, and on the right is the contours of the probability. So this is for the infected case. We have also the same for the recovered case and also for the dead case. But what is the application of this graph here? I can show it to you. Excuse me, do you have my voice, right?
Yes.
Okay, so I'm going to explain about the application of these graphs. If I want to act as the official or as a policy maker in a society, I cannot expect zero risk. It's like I cannot say I don't accept anyone infected in my community, in my society. This is not practical, right? So for any phenomena, for any issue such as the COVID outbreak, we need to take a certain amount of risk, or let's say target probability. So let's say I accept 20% of risk. If so, then we go through this contour graphs, the probability contour, and find the line, the isoprobability line for 20%. For example, this one, right? So then I go find the time. This is the beginning of the outbreak. This is the beginning of COVID. And these are the time, like day 100. I choose a time. And this is the future, right? We predicted the future. So I go, for example, maybe 1 month, 2 months, 3 months, 4 months later, I go to the time 700. And then I draw a line here up to the this iso probability line, like 20%, like this 20% probability. When I reach here, then I go to the vertical axis in order to understand how many people will die in this time based on this risk. So if this number of people is, I can accept that, so that means the current situation in the society is okay. But if this number is too many, that means we probably need to take further measures. Maybe we need to intensify the, for example, the social distancing rule, or maybe we continue forcing the people to wear the mask, or we need to increase the vaccination rate, or anything else that may help us to control the disease. And these are happening based on the risk that we may consider in our analysis. Yeah, that was all the presentation, the things that I wanted to show you here. Yeah, I do appreciate the time you spent to listen to my lecture.
Thank you very much for an interesting scientific research work, Mr. Masuli. So let's now open the floor for questions. Any question? Okay. May I ask a question then? Mr. Masuli, on your research work, did you factor in the strength of the Delta variants in terms of breakthrough infections on those vaccinated people? And secondly, did you also factor in the antiviral therapy on the number of critical patients who apparently died despite all the therapy? Thank you.
You're welcome. Yeah, thank you so much for the question you asked. Regarding your question, I would like to show you again the diagram that we have is like our model for simulating the COVID spread. No matter what type of mathematical model we're going to use, always there are some limitations. I will explain a few of the limitations we have. One of the limitations is that we're gonna think that if someone get the vaccine, so he won't be infected anymore, right? So that means that there is no link between the vaccination and infected. Also, we think that if someone take care of social distancing, he won't get infected. So there's again no link between these two. Additionally, we don't have any new compartment for type of I don't know, medical services or that show us okay what type of people go from the quarantine to hospitalized. I mean, which type of people the disease gonna be more severe. So if we want to go through those details, what we need to do is to add more compartment here in order to focus on the parameter that we want and again resolve this problem. But the more important thing is the tool, the probabilistic tool that we established in order to give the government a tool to make the prediction in future. So it's easy right now for the government to add any type of compartment they want and just get the results they seek. This is just the answer that I can give to you in the right now.
Yes, a very interesting answer. Thank you so much, Mr. Masuli.
My pleasure.
Any other question? Any other question? Okay. So I guess we can go to everybody's presentation. We can now open any other question pertaining to the three presentations that we have heard.
Okay. I will stop sharing the screen.
Oh, okay. So I believe Miss Joshi, I'm curious, and I just have a question regarding at the height of the pandemic, Miss Joshi, there was a super spreader, right? And I think it has something to do in India about the river where you have religious practices. How did you consider, or how was that factored in your research?
Yes, if we are talking about, there were incidents like even the political and the religious, as you mentioned, probably the Kumbh Mela incident you were referring to.
Yes.
A lot of religious practices are carried out, and many worshippers they travel on foot there. There were also incidents of political rallies for the elections. So it is related to the people's sentiments, and again, they were the events that exaggerated the kind of effects that pandemic already had in India. In our research, we are particularly talking about how the linkages between the urban and rural areas can be employed for building resilient systems during the pandemic situation. So yes, these events definitely need to be considered. but as of now, they are not considered in our research. That would pertain to like a different topic of research to follow through. So, yeah.
Oh, thank you. That was an interesting answer. Thank you so much.
Thank you.
Any other question? May I go back to Miss Babti? Miss Babti, you know, your hi, Miss Marad.
Hi.
Your findings, and that it appears very interesting. You know, the crisis governance and the scientific basis. Do you think? Do you have any other recommendation, or what do you think that it was a balance, or should there be more scientific basis more than the governance, the political governance? What do you think?
Yeah. So thank you for the question. Tomorrow I'm sharing a study I've done on 11 countries during the COVID-19 crisis, and analyzing the link between science and politics in the different country, and the way they have considered some other elements such as socioeconomic condition. So to answer to your question, here are the findings. The fact is that when we select science, we select a field of science. And in this case, this COVID crisis case, we have select a lot of people that are in the field of health. So, and mainly the acute issues of health. So, let's say the problem is not the link with science, is how you. The French used to have a tradition that separate science from policy, but in between you have some agency and institution that translate the best of science to the policymaker. In this crisis, we have something specific, where by political will, a committee of experts were selected. And the question were how they have selected this committee, since normally it should be selected by other experts. So there is something to think here. Should the politician elect scientists, or should we